Hello and welcome to my channel ACE Your MRCP. I am Dr. Aparajita Roy and today we will discuss a very important topic, which is what should you do if you are struggling to get a PACES slot. Passing PACES is a big hurdle, but these days, especially after COVID, it seems that getting a PACES slot is a bigger struggle. You may have put in a lot of effort and money, done all your preparation, invested in a good course, and then just before you're ready to take the jump, you get to know that your PACES application has been rejected because there isn't a slot available. That can be very frustrating because you have to apply for the next diet and you may feel all your preparation, time and energy has gone to waste because you have to again build up your preparation from scratch. It could also be the case that all your career and promotion plans are at hold. You may be sick and tired of your home country and can't wait to clear all 3 parts of PACES and start working in the NHS. Maybe you're not applying for DM entrance exams in your country because you want to start ST training directly in the NHS, and suddenly this cancellation and this rejection of your application brings everything to a standstill. Lastly, if you have taken your MRCP Part 1 a long time back, you may very well be nearing the time limit within which you have to complete all 3 parts of your MRCP. If that is the case, then it is a desperate situation. Now, the most important question is, what should be done about it? Now, let me tell you that I was in an exact same situation in 2019 when I was in India, all set, done all my preparation to go for PACES exam, and then my application got rejected. I was in denial, sad, angry, frustrated, and utterly clueless how I should move ahead in this situation. Just for the record, my PACES application had been rejected almost 3 times before I came across a very good hack which I have used myself and I've shared with a number of my colleagues who then have gone on to successfully apply for PACES exam. I will give you all the details later in the video, so please keep watching. So many of you ask me, what should you do? Should you sit tight in your home country and patiently wait for the next slot, or should you apply for international centers like the UK and try your luck here? So now that I have worked in the NHS for almost 3 years now, and I have a good understanding of the UK method of examination and the UK method of communication and interaction with the patients, let me give you my honest advice on this topic, that whether you should come and try your luck in a UK center. My honest advice is that if you have never worked in the NHS and you have no UK experience whatsoever, please do not attempt to take your PACES exam in the UK. It is very likely, there is a very high possibility that you will fail this attempt. Now, why do I say that? First of all, the bedside manners, the way we interact and communicate with the patients, the body language, it is very different in the NHS. And no course or no video lecture can teach you that unless you have actually worked here and soaked in that vibe from the environment. Number 2, the accent. Depending on where your exam is, you can get a patient with Scottish accent, Wales accent, London accent, and if you're not familiar with those accents, it will be a real struggle for you, especially in history, communication and Station 5. Not understanding the accent and hence that becoming a barrier in your communication is a recipe for disaster in your PACES exam. Lastly, there will be a very high chance that all the other candidates in your day, in your group, will have some form of NHS experience and you may be the only person who is completely naive to the NHS. The accent, the bedside mannerisms, etc. will come naturally to the other candidates and you will definitely stand out in the eyes of the examiners. Mentally, the examiners will always compare you with the other candidates and that may be a real big problem for you. So, my honest suggestion is, If you're still considering to make an attempt at PACES in the UK, try to get at least some form of NHS experience, maybe a clinical attachment or observership, something at least for a month, so that you can get settled well in the environment and then make a good attempt at your PACES exam. But the bigger reality is, even if you take the plunge and make an application for a UK centre, you may not be able to get a PACES slot even in the UK. Now, not many of the candidates know that for international centres, once you make an application for PACES, and if your application gets rejected because there are no available slots, your application automatically gets removed from the database and you have to reapply in the next diet. By this, I mean that the Royal College of Physicians do not go by a specific hierarchy or priority list, nor do they have in their database which candidates have applied multiple times, and hence they cannot prioritize those candidates who are waiting for a slot for many years. However, on the other hand, for the UK centres, there is a definite hierarchy as to which candidates will get a priority in their application, as opposed to which candidates who will be not getting a priority. The chances are that if you're not actually working in the UK, it's very unlikely that you will get a PACES slot in the UK. The hierarchy or the prioritization of the candidates is clearly mentioned in the MRCP website, and I would urge all of you to go through it if you're planning to make a PACES attempt in the UK. In a nutshell, this prioritizes candidates who are UK trainees or who are applying for specialty training in the UK, and also for doctors who are in non-training roles but are already working in the UK. So, by and large, this means that if you're an international doctor with no NHS experience and you're not currently working in the UK, it's very unlikely that you will get a PACES slot, even if you are ready to take the plunge and try your luck here. Now, before you get all angry and frustrated and tired at this situation, here is a simple solution that I can advise. Please ask yourself why you are taking the MRCP exam. What is your goal and what are you trying to achieve? If primarily your goal is to continue working in your home country and MRCP is just an addition to your CV or just an addition to your qualifications, I would suggest sit tight. Continue with your career plans and continue with your promotions in your home country. Continue practicing for PACES, continue preparation, and when you get a slot, then apply for it. Do not make a rash decision of applying for an international centre and wasting time and more money on it. However, if the reason why you're doing MRCP is to come and work in the NHS or to apply for specialty training in the UK, that is a completely different situation. In that case, please do not waste your time in your home country sitting and awaiting for a PACES slot. I would strongly advise you in that case to apply for an MTI job. Now, why is that? Here are top 5 reasons why I would urge you to take up an MTI job as soon as possible. Number 1. MTI gives you a good, strong foothold in the NHS, and as I've already discussed, good NHS experience is invaluable for your PACES preparation. Number 2, you get a study budget. You can use that study budget effectively and smartly to do further courses in the UK to better get acquainted with the UK method of examination and use that to pass PACES whenever your time comes. Number 3, you will get study buddies. You will find more candidates like IMTs, other MTIs, SHOs who are also preparing for PACES than you would find them in India. Together, your preparation will be much better in a group. Number 4, if you're planning to apply for specialty training, you can mention that in your application and then that bumps you up in the priority list as discussed before. And number 5, the most important reason is that MRCP is only one of the criteria to be eligible for application for specialty training. There are a number of other criteria that you would need to fulfill other than MRCP, and While you're working as an MTI, while you're waiting for your PACES, you can work on those criteria and work on those competencies so that once your PACES is done, you can directly apply for SESTI training and not waste any more time trying to acquire those competencies after you've cleared your MRCP. This would save you a lot of time and energy in the long run. If you're unfamiliar with MTI or Medical Training Initiative, please watch my video on how to get an MTI job, and please also read my ebook. This will give you a comprehensive idea as to how to apply for MTI jobs and give you an overview about Medical Training Initiative in the UK. Now coming back to my story, when I was in 2019 in India, frustrated and angry that my PACES application got rejected, this is exactly what I did. I put all my time and energy to get an MTI job, and finally in late 2019, I managed to come to the UK and start working as an MTI fellow. However, my quest for a PACES slot continued in the UK. When I applied for a PACES slot in 2020, it was rejected because of COVID, and when I applied for a third time, it was rejected because there was no available slots. I was not planning for training application at that time, and there was no one to guide me that planning for a training application would improve my chances at getting a PACES slot. So here I am sharing all the hacks with you. Don't make the mistakes that I did. These are the tips that will help you to definitely get a PACES slot sooner. Now that is when I discovered a hack which has not only worked for me but has also worked with many of my other colleagues with whom I shared this hack after my PACES application was successful. This hack is very simple but very effective. I emailed the RCP exam team giving them my details, my RCP number, and mentioning that these are the number of attempts I have made for a PACES slot. And I would be very grateful to them if they could please let me know of any last minute cancellations or any last minute slots that may be available just before that particular date. And lo and behold, I got an opportunity to appear for PACES just 7 days before my exam date. I know it was not ideal, but this was my only chance and I had to make the most of it. Thankfully, I had kept my preparation going and I had a good study group to help me continue my preparation at its top level, and when the opportunity came, I was able to successfully appear for my PACES exam. So there you go. It is important to keep up the faith, never lose focus, and continue the hard work. I hope this video has given you some insight and some hope and direction in these difficult times. If you have liked the video, do give it a thumbs up, consider subscribing to my channel, and let me know in the comment section below what other topics you would want me to make videos on. Till then, as I always say, stay safe, keep studying, and ace your MRCP.